So a little about me. Of course, you know who I am because I was the guy on the video. But have 3 gyms. We've been open 16 years. Probably helped over 3,500 people plus lose over 45,000 pounds. We kind of stopped tracking a couple years ago. And for us, you know, Stretch came out of a need for the clients. And one of my clients came in super stretched out. If you understand like anatomy, physiology stuff, right? Stress produces cortisol. When cortisol is super high, you're at high risk for injury. So you can't work out at the same intensity that you normally do work out if, oh, the lights, hold on.
I don't think it's on.
I know, I see your face.
I'm glad you can see my face.
You like that? I see your face. Who knows? Hold on. When in doubt, use the other one. Good thing I didn't say anything important. Okay, there it is. You see it's doing it now? When I talk, the thingy moves.
I pressed the button and...
Don't press any more buttons besides the record button. Is the record button recording? No, like on the camera, on the phone.
Yeah.
The record button, it's recording.
Yeah.
It's recording. If
Okay.
this is green, we're good.
Okay.
See when I talk, on top of the little monitor, it moves back and forth.
That's what I'm talking about. Like I pressed the button and now it's like on menu and I don't know how to get out the menu.
Don't worry, it'll just default up.
Okay, never mind. You're good.
See? There we go. I was saying something important, right? So anywho, when clients' cortisol levels are high. When cortisol levels high, it puts you at risk for injury. You know, so if she's coming in tax season, I'm not like, the way you look, you probably shouldn't do a regular training session. Let's dial it back. You know, let's do like a lighter session. Let's do a light week. Drop cortisol, get back to training next week. So we did that. Next week she came in, it didn't look too good. But if you know anything about tax season doesn't like doesn't drop off until the 15th. So it just goes like this from February till April, mid-April. So I was like, let's do another light week. And she was like, I'm not paying this much for light weeks. And she's like, can we just do the stretches we do at the end of the workout for the workout? I was like, yeah, I know, like flexion, stretching is extension, sure. I could do that, you know, so we did. And somebody else saw me stretching her just on a bench and was like, what is this? And I was like, active facilitated stretch. I had no clue what to call it, you know. Even on our website for years, I had a super long name and everything around it. I was super technical with it, but it started to grow. And then people started coming to solve these different problems. So I went down the rabbit hole of corrective exercise. I did the rock tape stuff. I did all kinds of movement things, trying to figure out how can we solve this issue. I'm getting several stretch certifications. And I remember in 2020, I was like, we need to figure out a way to systematize this. I could see like the future was coming and there was this influx of people coming in and we didn't have systems around it, you know, and I'm a big systems runs your business guy. And so I said, what if we treated stretch the exact same way we treat personal training? And we did, and I was like, okay, cool, what happens? Someone comes in, they do a consultation, we figure out what's going on with them. Because before it was like, hey, can I get stretching? You know, like, because it would only be our clients, you know, and maybe one of their friends that was like, oh, what happened? My back was hurting. Go there, they can help you with your sciatica issue. And they come and I just stretch them. So I was like, let's do a consult, but then we need to do some sort of assessment, right? Because normally you in-body and you assess their fat and their goal. So like, we need some sort of assessment. So I got the barbell rehab certification. I got all these different certs, and everybody had I got Brook Bush certifications. I was like, everybody had all their assessments. I was like, okay, cool, we need it. So we experimented with that, and then we needed to have a sales process, a way to say, okay, the purpose of a sales process, I know sometimes trainers are like, sales, but the reason why a sales process exists is because you're telling your client within this time frame, I can solve the problem that you present. Give an example. Someone shows up to you and say, hey, Julie, train me, and I want to lose 20 pounds. I want to do one session. Exactly. You know, we're not going to get the results in one session. So for me, I couldn't like sell you one session knowing that one session is not going to really help you. So I was like, okay, what's time? As you start studying this stuff, it's called neuroplasticity or neuroadaptation. Basically, your brain can rewire itself, but it takes at least 3 months for that to happen of repetitive information. So I was like, I can't sell less than 3 months. I can't sell you like 5-pack, you know. Nothing against massage therapy. I couldn't treat it like massage therapy because even though I love massage therapy, the way massage therapy works, it's like, oh, this kind of hurts a little bit. Okay, cool. Day in there, and then I don't see you again because massage relax, but stretch retrains. You know, so we were like, no, we have to do a minimum of 3 months. You know, and then we started to play around with it and realized that 6 months was actually a better time frame because we started to unlock areas that where it wasn't the root problem. So I'm not sure if I'll talk about it here. I know I've been talking about it a whole lot other places, but the way you want to think about it is like your fascia. Is everybody familiar with fascial nets? Yes, no, it's okay to say no. It's like this. You ever eat cooked chicken?
Yeah.
Okay. You pull the skin back, and you see that clear goo that's called fascia. It's this connective tissue that surrounds all the cells. It allows us to actually hold posture and our muscles and tissues and everything the way it is. Without fascia, we're just a meat sack, right? So the challenge is that how we treat our body. Huh?
Thank you for using that word.
No
It's
problem.
one of my favorites.
Oh, nice. So it's this series of connective tissues that is very viscous. It like moves, but it can also be very rigid. So if you think of like your TFL, that's all fascia, but it's not designed to move. Like they say, like your TFL can hold like 2,000 psi, so 2,000 pounds of pressure per square inch. But it's everywhere else, and things move with it. Anywho, the problem could be here, and if I pull here is affected. But so we started realizing as we start fixing one problem area, something else popped up. But it wasn't that it popped up, it's just that this was screaming so loud you couldn't hear what was happening here. And then we just noticed over time we can start identifying what the root problem was. So like for us, we don't give at-home recommendations until 3 months because we don't even know what the real problems are yet. But then afterwards, we can still give things to do at home. But 6 and 12 months was like our sweet spot. So anywho, that's kind of like grew the stretch program. Now we do like, it's crazy. We literally do more revenue from stretching than most gyms in America do altogether. It's wow. We're at a point, like last night we spent probably an hour doing this capacity study trying to figure out like how many more people can we take, and we still have like people requesting. So we're like, it's almost like a doctor's office. It's like, hey, I can book you an appointment like in 2 weeks. I need your credit card number on file. I need you this, because we're just trying to figure out where to get in. But it's such a joy. I did put some notes. I wanted to like look at it because I think you guys are the first woman actually gonna talk to with it. But it's really, really good stuff, and it's not because of my notes. And then we're gonna go into like the pro tips, but I wanted to start with this here. So in the fitness equation, we think of like, nutrition, right? Because people are like, hey, I want to change my body composition. Well, it doesn't happen unless you change what you put in your mouth, right? So nutrition, right? And then we know like, hey, no matter how well you eat, eating won't get you strong. So we have exercise. That's the reason why the GLP-1 drug is not an issue for us, because like it's not gonna put muscle in your body. You know what I mean? So you can use it, you cut fat if you want, but you're still gonna need some strength training. So, but then the other side of it is that you have to recover. And we live in an environment that's heavy in stress. We don't even think about things like anywhere from the lights that affect our body to, the technologies that we're plugged into all the time, the way we live. We live in what's called the sagittal plane. I pay attention to that a bit too. So, meaning we only go forward and backwards. Think about in your day, how often you do lateral movement. You're never like, oh, that thing's over there. We just snatch that. You're like, it's just weird. You turn and you go straight. So we only go forward and backwards, but it keeps us stuck in a certain movement pattern. We sit and we type and we crunch the front, our anterior side of our body. So it's overactive, it's called, but our posterior side is weak. So we have typically rounded shoulders, which decrease our lung capacity, increases risk for headaches, weakens our upper back muscles, and our core and all that, like super tight, in there. Our psoas is tight, and the psoas connects from the front to the back, and also from the bottom to the top, so it causes low back pain. So we live and move in this environment that stresses us out. I was just studying to make sure I gave you accurate notes. 1 in 6 Americans are on an antidepressant or some sort of mental health medication today. That means in this environment that we're right here, on average, 2 of us are. It's not a judgment. It just shows how stressed out we are as a community. And we're trying to solve it with all kinds of things. this is where recovery comes in. If we can downregulate the nervous system. So now if I go too fast, just like wave, I'll slow down, I promise you. But so stress, right, impacts your body. Your sympathetic nervous system picks up. If you think of your nervous system, there's two sides, but the side that we're talking about right now deals with managing stress or recognizing stress, which is not a bad thing. Stress is just change, adaptive, so it recognizes stress, and the other one recovers from the stress. So you think of like, fight, flight, all that kind of stuff there, and recovery, digestion. No one's like mid-fight and needs to use the bathroom, right? Your parasympathetic nervous system shuts down. It's like, I need to run from the bear and I got to take a dump. It doesn't happen that way. You run from the bear, you don't even think about other movements. So when you're hyper stressed out, you struggle with sleep. And you think about how many sleep aids we have currently in our marketplace, and things we're trying to do to sleep hacks and everything else, because our sympathetic nervous system is on charge. So we have nutrition, we have exercise, and this is where recovery comes in. And recovery is not only stretch therapy. Like if you look at it right now in the wellness industry, people are doing red light therapy, they're doing ice plunges. I'm curious in my area, because we live in the north as well, what everybody's gonna do with an ice plunge in the middle of the winter. It's like walking outside is an ice plunge and I'm gonna get into frozen ice. I don't know. I think some of this stuff is a little gimmicky, but I don't know. It hasn't had enough time. Is there a benefit to it? Yeah. Is it sustainable? I don't know. But I know since the beginning of time in wellness and fitness, all the way from yoga all the way through, that people has been doing stretch because it just helps you move better. So our goal is to help downregulate that nervous system for people who are experiencing pain and elevated stress levels. Our technique is designed to also be used pre-game, meaning that because we don't hold the tissues for long period of times and we don't stress out the tissues too much, you can actually stretch your clients before a workout or after a workout. So we're not limited with that. If there's a stretch that we do that is not good pre-workout, I'll be like, hey, I wouldn't do this pre-workout in there. And there are some that just puts you down. Like it's like you shouldn't be like, all right, deadlift, you know what I mean? But most everything else is designed to do that. So that's one of the things in here. We live in, I told you about, in a way that our body hurts. The numbers, 80%, according to recent studies, 80% of people are dealing with low back pain. So it's not abnormal to sit down and be like, hey, anything go, literally in my consultations, if someone doesn't tell me their back hurts, I'm like, are you sure? You know what I mean? So 80%. 70% dealing with shoulder pain. They say 25% are stiff on a regular basis. So there's a huge need with it, and this is our opportunity to literally help our community with a different modality. The better you recover, if anybody, you're an athlete, the better you're, as an athlete, you sleep for like 8-9 hours a day. What do? I take class, I eat, and I sleep. I love it. Like, people are like, I was a college athlete. Okay, cool. It means you didn't go to parties. Because you have to sleep. To recover, because if you don't recover, you can't play the game the next day at your highest level. Well, our athletes are CEOs, they're managers, they're leaders, they're moms, they're dads. And if they don't recover, they're not giving their best self to their kids, their parents, their employees, their coworkers, the people in their lives. And so stretch is a tool to help with that. So just want to share a couple of other things in here. Over the 16 years, what we did as a solution was used to send everybody to PT or chiro, right? Someone comes in, your back hurts, okay, cool. Go see a chiropractor, go see a physical therapist. And what do? You've been doing 20 years. What happens to your clients when they go to the physical therapist?
They have to stop doing certain things.
That's exactly right.
Yeah.
The physical therapist says, hey, here's a doctor's note. You can cancel your gym membership. I'm like, when did movement was not the solution? Mm-hmm. So we were like, that sucks. Like, we got to figure out a better way. Now, most of my physical therapists didn't look like me. Not that I'm the picture of hell, per se, but they weren't like they were into fitness either. Mm-hmm. They just took classes and passed the test. But they would say, stop exercising. Mm-hmm. And I'm like, for the rest of your life. Your knee hurts, so you should stop exercising. Maybe you should build quad and VMO strength, and your knee could stop hurting. But that was the solution. So we need to do something else.
Can
Go
we
ahead.
address that real quick?
Mm-hmm. Absolutely.
So I also want everybody to think about what PTs actually do when, and especially if they're insurance-based PTs.
Mm-hmm.
They're not treating the whole body.
Correct.
They're only treating the item that they've gone in to complain for. So they're treating only the knee,
Yes.
only the hip, only the shoulder. And what we're going to be learning through everything that we do today is that in order to fix that hip, that knee, that shoulder, is by treating the whole body. So it's so important to really understand that somebody's back might be hurting, but it's not their back all the time. It's the IT band, it's the TFL, you know, it's into the glutes and stuff. It really is lower body. But again, a PT is only going to treat what was recommended, and they, of course, telling you to stop is not ideal either. But they're then not working the rest of that body in order to get past that. So.
We actually say that exact same statement in every consultation. You know, it's so important that people understand that. We built this culture that if you have an MD, a doctor, a higher degree, you know everything. But the reality is that insurance is what's guiding it. Pharma is what funds med school. You know what I mean? So they're taught how to prescribe medication. They're not taught how to solve, you know, problems or challenges. But insurance dictates, and that was my story. You know, I ruptured a disc in 2018 in my lower back. I went and, you know, I got that done. Shortly thereafter, my infraspinatus tore. And I'm like, how do I take? And I literally went to my PT and I was like, I tore my infraspinatus. Now, of course, I'm just a trainer. You know, like, dude. So he's like, it's not your infraspinatus. People don't really tear their infraspinatus. It's your supraspinatus. So your infraspinatus in the back here is responsible for shoulder abduction in the transverse plane. So it does this, right? He said people don't tear that muscle. You know, it's probably your supraspinatus, you know, which is a common place to tear. You know, it's like, you were a freshman. You weren't even in high school you were maybe in high school when I started my gym. I'm telling you, it's my infraspinatus. But insurance is covering it. So we did all the supraspinatus recovery stuff, and I'm still in pain. Well, if you're still in pain after a certain amount of treatment, you go get an MRI. We get an MRI, he calls another PT in. He's like, dude, check out this guy's supraspinatus. We've never seen a supraspinatus this developed, but you do have an infraspinatus tear. Nice. You know? So my exercise science intern, who's now the director at our gym, Amanda, she was with me at the time. She was in her internship, and she just lost all credibility in the industry. It was just like, we just went, because I used to say, because she's in school, I was like, why don't you come to all my PT visits so you can see it, you know, like, because, you know, it's different in that perspective. And she was like, yeah, that sucks. So anywho, you know, that's not cool. So the difference between massage and stretch is massage relaxes you. So it's a really good modality. I love getting massages. Stretch retrains your tissue. What we're doing is, when you get injured, we talk about the sympathetic nervous system, right? When you get injured, your brain goes, ouch. And if it hurts, your brain wants to avoid pain. The reason why, like, whenever someone gets in a car accident on the other side of the street, there's traffic on this side, is because our amygdala, part of our brain, which looks out for things that may hurt us, right, is looking to see what happened wrong. And your body's always looking for what the bad news is. That's the reason why, you know, the news media has grown like crazy over my lifetime. When I was a kid, news came on like once a day. You know, it came on at night. You know, the kids were put to bed. Now it's on all day long because our brains are like, oh, I need to see the problem. So anywho, you get injured, your brain goes, ouch, don't go there. And then you start developing what's called adaptations in your movement patterns to keep you away from the thing that hurt. So you just stop moving there. And this all happens at a very subconscious level. You know, if you think about, you take this to like kids in behavioral health, you reach towards a kid and he flinches, you know he's getting abused at home, right? So it's the same thing that happens physiologically when we bang our toe, or we got into a car accident, or we tweaked our neck. Our body's just gonna like stop moving as much in that place. Fascia, this connective tissue that tries to hold you down or keep you moving, it says if we're not gonna go there, let's prevent that movement. You start building tissues that cause restrictions. Over time, these restrictions down the ladder causes pain. Because now when you try to move, you can't move the way you were supposed to move, and pain is as a result. So what we're looking to do is to retrain that nervous system to say, no, that movement that you got is okay. So you'll notice in our techniques, they're fairly gentle. In our techniques that we're gonna use, yet we're gonna still get the outcome. So it's a little bit different than traditional manual therapy, where like you go to the massage therapist or the physical therapist and they say, I'm gonna move that tissue, or your chiro is gonna move that tissue to where it belongs. We don't do that. We work with your nervous system and says, hey, let's get it to where it can go, which eventually may be where it belongs, and some people may never be there, depending on what's going on, and there's a lot of different things that affect it. Cool? So moving forward, the idea is muscle move bones, right? So your bone, humerus bone, muscle is pectoralis major, but they move bones through joints, right? So my pecs are responsible for horizontal shoulder adduction, but that happens through my shoulder joint. So muscles move bones through joints. Nerves innovate. So you have someone with a stroke, or we have a client with a brain injury. He dropped off a boat, boom, smacked his head open, and he has a brain injury, and his arm is stuck like this. Right? But you can use all the power in the world. You're not moving that arm. You will tear the bicep before that arm moves, because the nervous system says that arm does not move. Now we've got his arm down to here. It won't stick because of the amount of trauma was in the injury, but the difference between here and here is really big deal when you're dealing with that pain. His mom was like, hey, this is a solution. He'll be here for the rest of his life as long as you can stay open, because this is a big difference in the quality of life that he's able to have, which is interesting. So we want to work with the nervous system in there. So it's really gentle. It's not like, for those who've been around for a long time, old school self-myofascial work. You find that night, you dig into it, you work it out, you cry uncle, you write your will, but tomorrow you're gonna feel great. Hopefully. And you go, it's not good unless it hurts. That's not our jam. You know what I mean? So I'm gonna switch gears real quick, and this is the most sitting and talking we're gonna do. I'm just gonna run through the pro tips to ensure everybody is on the same page. Before I switch gears, any questions for me? Okay, cool.